Okay, we ended here before I got cut off again.
Yeah.
Yeah, here it says vaccine. Remember I said in the beginning, it's going to be attenuated bacilli from the bovis strain. All right, so has anyone heard of leprosy?
Mm-hmm.
Yep.
Okay, so we know that Mycobacterium tuberculosis grows very, very slowly. Leprosy, lepri grows the slowest of any of them, right? This is also called Hansen's disease, right? The other thing is a very, very strict, let's make sure no one wants to get in here. Okay, strict parasite has not been grown on artificial media or tissue culture. So we can't even really study this that well. And honestly, we still don't know how it's transmitted. We're pretty sure it's cutaneous, right? Slowest growing of all species, multiplies within host cells in large packets called globi, right? Causes leprosy, a chronic disease that begins in the skin and mucous membranes and progresses to the nerves. The other thing about this, all right, it's very, very superficial, right? Why do you think it doesn't delve deeper into your tissues? Anyone want to guess why that is?
Does it need oxygen?
It needs oxygen, and it also doesn't like the temperature. Remember, your outer surface of your skin should be cooler, right? Okay, and it's not like they used to have leper colonies where they thought this was infectious and people, you know, were diseased or stupid or evil or whatever. All right, so this you really can't get from casual contact like we used to think. Right? Oh my God. You guys are so patient. I can't even believe it's this patient because I'm about to lose my mind.
And we know it's not your fault.
Well, I've been on the phone with, you know, these people, and they said, "Oh no, it's fixed." And I can't back up. Lord. We're almost done here, and then I'm gonna lose my mind and have a drink. Okay.
Nothing wrong with that.
Yeah, I'm old enough.
That's right. You've earned it.
Yeah, you guys earned a drink too, believe me. After all this, play from current.
It's going to be eat dinner and take a kid to soccer practice after this.
Oh, good Lord. You're such a good dad.
Oh, yeah, I try.
So, epidemiology and transmission of leprosy. Endemic regions throughout the world. We're recording. Okay. Mechanism of transmission is not fully verified. Not highly virulent. All right. Okay. Appears that healthy and living conditions influence susceptibility in the course of disease. All right. So, these people are probably going to be very crowded. They may not have the best health conditions, the best nutrition. It may, anything that would cause them to have a diminished dendritic cells. Remember, those dendritic cells, or cells of Langerhans, they're called too, are going to pick up this bacilli in the tissues and hopefully bring them to your lymph nodes so that you can expose them to a B cell and produce antibodies to it. You know, but this may not be possible if their immune system is compromised or if they've got other things going on. You know, their dendritic cells or Langerhans cells could be busy doing other things too. May be associated with specific genetic marker, so people may be more specific, have more propensity to it than others. The very question I've seen, which is completely bizarre, is the only other reservoir for this besides a human is the armadillo, which is crazy. But all right, so macrophage phagocytize the bacilli, but a weakened macrophage or slow T cell response may not kill the bacilli. Right. So remember, macrophage is going to present it. The T cell, if it's comes in contact with the MHC1 marker is going to go in and kill this thing, hand-to-hand combat, if it's working. Incubation is 2 to 5 years, super slow growing. If untreated, the bacilli grow slowly in the skin, macrophages, and Schwann cells of the peripheral nerves. Right? And like with shingles and everything, if it's in the peripheral nerves, sometimes it can hide from the immune system in there. All right, so there's 2 forms possible: tuberculoid, like tuberculosis, or lemachus. So it looks like a leper. We used to call them lepers, leper colonies. And you'll see the difference. Like the skin pattern on the leprosy or lemachus is going to be like a leper. All right, so tuberculoid, asymmetrical. All right, shallow lesions, damaged nerves, results in local loss of pain receptors. So this person, literally, if you did dermatomes on this patient, they wouldn't feel anything in this area. All right, so they don't even know, like, if they don't have feeling pain or anything, they're gonna, not worry about it. It doesn't bother them, right? They can't feel it, but they could cut themselves there or have a bite there or something. They don't feel it. It can be very, very, could be very scary or not a good thing. This is the lemachus or lemachus. It looks like a leper. So deeply nodular infection that causes severe disfigurement of the face and extremities, widespread dissemination. So this is what they, used to really, people used to get afraid of. They think these people were evil, or, back in the day, they didn't know what was causing it. So these people were shunned and they have leprosy colonies, all right? So what's interesting about this picture is this poor girl has leprosy, but she's got gold bracelets on. All right. So this person here is probably from, South Asia or wherever, and that is just displaying wealth. These people wouldn't have this. So it's not like she couldn't afford medical care. She probably can't get to it, right? In this case, right? Combination of symptomatology, microscopic examination of lesion, and patient history would be how you diagnose this. And, we'd hope we diagnose this year 2. It takes so long to have it incubate. But numbness of hands and feet is a sign, loss of heat and cold sensitivity, because it starts damaging those Schwann cells, it starts damaging those peripheral nerves. Muscle weakness, they're not able to activate the muscles. Thickened earlobes, chronic stuffy nose from all the swelling, and then, detection of acid, fast bacilli in the skin, nasal discharge, and tissue samples, which is back in the day. But, these people nowadays, if you look at them and you'd be able to get some signs and symptoms, and you'd be able to probably diagnose that right away. You might want to rule out a couple things, but diagnosis can be pretty quickly these days. All right, treatment by long-term combined therapy. So sometimes it's more than 2 antimicrobials. Remember, this divides really slow. So if TB is 2 to 6 months, this might be, 6 months to a year. And the problem is most people are not going to take the antimicrobials religiously for that amount of time, all right? Or they take them for half the amount of time, they start feeling better, and they stop taking them. Prevention requires constant surveillance of high-risk population. The World Health Organization is sponsoring a trial vaccine at this point. Right, here's just a couple other. Whenever you guys see avium, it always means bird. All right. 3rd most common cause of death in AIDS patients. They get this. It's very, very slow growing. And I said before, if you have microbacterium, your body can consolidate this usually. All right. But these patients have AIDS, so their CD4 cell count's low. They have nothing to activate their B cells or T cells. Nothing to do with triage their immune system. And this was very common back in the early 80s, all right, when AIDS first came out with HIV and AIDS. And these people would be on their rooftops in New York City, right, on the roofs. They used to hang out on the roofs, and they would get this from bird droppings and things like that. Marinum, if you see this, usually it's a swimming pool granuloma. Somebody scrapes their skin, it's in the water. Remember, these are superficial, it gets infected. All right. Paratuberculosis from raw cow's milk, recovered from 65% of individuals diagnosed with Crohn's disease. All right, so I know there's a big surge in the Midwest. People are demanding raw cow's milk, which is illegal apparently. But yeah, another reason why people are fighting for pasteurized milk. There's a swimming pool granuloma, right? So that was caught usually probably on a concrete granite pool or whatever. It was in the water on the surface of the pool, got infected, and that's going to be local. It's usually not going to go much deeper. May invade the nerve roots because it wants to stay cool. It wants to stay superficial. Okay, so the last thing I'm going to cover is filamentous bacilli. All right, so this is bacilli. It's growing, but it's filamentous almost looks like mold. It has almost hi-fi looking things. All right, so if you see Sidiomyces and Nocardia, these are non-motile filamentous bacteria related to the microbacterium, and they cause chronic infection of skin and soft tissue. Right. So if you see this, if you look, all right, it just looks, it's very, very fuzzy, filamentous. Okay. All right. I think we'll end there. I am going to go have a little chat with Zoom. All right, and I will upload these videos tonight for everyone that couldn't make it. All right, any questions?
No.
All right,
I'm good.
go ahead. All right, did anybody try the lab practical yet?
I took it.
No,
Yeah.
not yet.
Was it okay?
Yeah, it was okay. It was just that one question that threw me, but
Okay.
But other than
There were
that-
a couple questions that I had already seen before, but yeah, it was okay.
Yeah.
yeah, it was good.
Okay. All right, no problem. If you guys have any questions, just email me. Never a problem. Hopefully I'll have this straightened out by tomorrow again. All right, and I will upload the Zoom. I'm going to try to get all of them done tonight, but they take like a half an hour to convert and put them into my YouTube page, but I'll take care of it. All right, I see everyone tomorrow.
Okay.
All right, have a good night. Thanks
All right,
for
see ya.
Phil.
dealing with
Bye.
me. All right.
Bye.
Bye, guys. Okay. And,